So this is a part 2 on depression. Because once again, I am making this for the people who struggle with it secretly and is not saying anything. Just for you to understand it a little better to help you cope with it. So now let's look at the effect of depression on the brain. Doctors observed that the hippocampus used to store memory in the brain, the small part of the brain, that small part used to store memory, gets even smaller in the people with depression. And the stress hormone called cortisol is being released in excess in people in depression. But sadly, there is no cure for depression. There is, however, psychotherapy and antidepressants. I rather get to know about the disease so you could know, compare it to your life, and figure out how to cope with it and keep it at a low. Now here is how to tell if you have depression. We already looked at the causes of it and how it can affect you. Here, how to tell if you have it. We have feelings of hopelessness, loss of interest, increased fatigue or sleeping problems, anxiety, which is a wide topic, I will talk about that one, irritability in men, I'm also going to talk about that one, change in appetite and weight, and uncontrollable emotions for women, and suicide, which is rising a lot lately. Now, men don't have as much hormones as females do, so they don't show depression the same way. Here is some ways that I researched and found out how to tell that a man is depressed. There is escapist behavior, such as he always want to work overtime, or he always want to be out, he just want to be away, just go. Physical symptoms like headache, upset stomach bug, alcohol and drug abuse, drinking, smoking a lot, controlling, violent, abusive behavior, irritability and inappropriate anger, always getting upset, always irritated, and risky behavior. Men do this a lot. Like walking across the road, just walking across the road, ending up in fights, ending up in all this, doing risky stuff.